The role of midwifery in reducing maternal and child death, I think, is really to ensure that they are there when they're delivering the babies. These are the most skilled workers that we have for that purpose. But it doesn't only end there. They also need to sensitize to the communities in which they serve that childbirth does not only begin when a mother is giving birth, but there's also other issues that need to be dealt with before that. They need to be sensitized before pregnancy, during pregnancy, and of course during childbirth and after pregnancy. Antenatal is also very important. If I were a health worker in my government, I think I would call upon my government to do a lot to support me. The first thing I would ask them to do is to ensure that they enroll and also train more midwives. Train as many midwives as possible, and at the same time to try and sustain them in the sense that they have to provide the equipment and the proper environment for these midwives to work in, and also to ensure that these midwives are compensated in a manner that will keep them in their jobs. In Zambia, the sustainability of the workforce has actually been enhanced by the fact that the government is now very much involved in building new training schools, enrolling more health workers, and not only that, but also trying to improve the dilapidated infrastructure that was there before, the hostels, the training institutions for the midwives. They've also put in place within the hospitals provisions where nurses, for example, can take courses while they are working to become midwives. And this has helped a lot. They've also partnered with a lot of the donors and also the cooperating partners in establishing private schools. These private schools are not independently working, but collaborate with the government a lot, in the sense that the government does provide the facilities for these training students to go and do their practicals, but at the same time they also ensure that after the graduation is done, they are employed within the health facilities of the government. The strategy that has been developed by the World Health Assembly, I think, seeing it forward, is more to ensure that health delivery is done at the national level. They have to ensure that this is done, and not only that, focus should be at the level of primary care. That is where the issue should be dealt with the most, because from the primary health care going up, not much needs to be done. The most important thing is the lowest level of treatment. We feel that is where the focus should be.